Talking a little bit about the pandemic, it has triggered a youth mental health crisis. Many experts were seeing a rise in depression and anxiety before the pandemic, but remote learning and feelings of isolation, well, it made the problem even worse.
Dr. Ashley Zucker is a child, adolescent, and adult psychiatrist with Kaiser Permanente in San Bernardino, joining us now to talk about how we can address this crisis. Good morning, doctor.
Good morning. Thank you so much for having me today.
Of course. Great to have you back. Okay, we're coming right off of two stories of these mass shootings. An 18-year-old who was expressing problems at school and then goes on a rampage. Then we have a shooting at a church locally. What do you think can be done to address the crisis that kids are going through, that adults are going through? I mean, it's very scary. I know kids waking up this morning are having a lot of questions. How do we talk to our kids about what's happening in the news?
Sure. I mean, it's very, very unsettling. I think, one of the things that we face as a society, early Monday, can't get my words out, sorry, is that, there's just all this upsetting things happening over and over again. And I do think it's important that we talk to our children about what's happening, especially in light of the news this morning, asking them if they have questions. Oftentimes letting them sort of prompt the conversation can be very helpful, and keeping that open dialogue. The worst thing we can do is try to just not talk about it and kind of shove everything under the rug. That can only make things worse and also make our children feel much less settled and safe.
Yeah, and let's talk a little bit about the power of social media. We know it's played a role in the youth mental health crisis. Why is that? And also, what can parents do to make sure that their kids are staying a little bit more positive and, not being so negative when they go on social media?
Sure. Social media is not all negative. I certainly don't want to give it that reputation, but I think some of the things to be aware of is really what our kids are looking at on social media. Social media gives us access to each other 24/7, and so sometimes there can be bullying that can be happening, and that can happen around the clock. Certainly if they're looking at a lot of negative news stories, or even if they're just comparing themselves to others constantly on social media. Those are some of the more negative sides of social media. And I think the most important thing that we can do as parents is to really try to not just be aware of what our kids are looking at on social media, but set some guidelines and some boundaries. And as adults, we probably need that too. So it can be good to model that for our kids.
And Dr. Zucker, oftentimes parents are concerned about their kids, but they're thinking, okay, maybe the school's helping. They don't want to stress out their kid, but sometimes it's easier to sweep it under the rug. How do we know that a child is struggling seriously? They may need some help. Even, the shooter, going back to that story, they had been evaluated at school. Police had evaluated them and they said they were fine. So how do we know what to do?
Yeah, I mean, it's a good question. We can evaluate and we can ask kids how they're doing, but we only have what they tell us. I do think it's important to be aware of some of the warning signs. So if you notice a change in your child's behavior, if they seem more withdrawn, they're isolating themselves more, especially if you notice an increase in irritability, that can be a warning sign that they're suffering from either depression or anxiety. And making sure they are getting that help. So, if they are getting help through the school, that can be good, but also checking in with their primary care doctor or their pediatrician to see if maybe, having them see a therapist or a psychiatrist would be appropriate. And so again, it's that dialogue and continuing that dialogue. Just one touch evaluation doesn't necessarily cover everything depending on the situation.
Yes, for sure. Well, great reminders. For parents, where can they go if they're concerned about their kids or just need a little bit of extra help to make sure their kids are having that positive mental health?
Well, I do think the schools are a great resource. They have a lot of mental health resources and usually counselors on site, but also pediatricians, primary care doctors can be another great resource. They can often help with a lot of things or help direct parents to other mental health professionals if needed.
Thank you, Dr. Zucker. It really helps just being able to talk about stuff that is so uncomfortable.
Oh, 100%.
And yeah, I have a 5-year-old who's going to be 6 soon, and I'm wondering, okay, how do you address it? Because kids end up talking to each other and making their own assumptions about things.
Absolutely. Yes, keeping that open dialogue, no matter the age.
Yes, thank you. Good reminder.
And happy Monday. I'll
Yes.
have a cup of coffee with you.
Yes, we're all still waking up,
Right.
and yeah, rough weekend of news. So thank you. Really appreciate
Yes.
it.